Hey guys, welcome back to my channel. So this is the fourth and last episode of my series on culture and spirituality and mental health with Atasha Jordan. I hope you have enjoyed this series and take a look at this episode as we discuss when is it important for mental health providers to ask about spirituality and how to do that. Keep on watching.
How often do you as a mental health provider actually ask your patients about their spirituality? Because I would say for myself, it's not a part of my training. And even though I am now more and more recognizing the importance of that role, of the role that spirituality has on our mental health, it wasn't formally taught in my training. So now it's me trying to figure out, how do I embody that and embed that into the questions that I ask? So I was just curious for you, like, is that something that you even bring up when you're doing your mental health work, to ask in a regular way a patient's spirituality?
Yes. So for us, we have like intake paperwork, and that's part of some of the questions that we ask. Not everyone asks that question. Like you said earlier, I think a lot of times we are trained to prioritize safety first, and are you suicidal? Are you in danger? Things like that. So kind of like suicide and homicidal risk assessments is definitely a priority when a patient first comes in. But I personally do ask that question because, like we were talking about earlier, it can be a great coping skill to help somebody really, get better. And so, and especially in the majority of the communities that we work with are communities of color. And so I know that spirituality is important. And so I know that I want to ask about that. And how is that influencing their decisions? How is that, sort of strengthening them or not? And I mean, I think that on the other side of the spectrum, there's also this idea of how religion and spirituality in their family, in a child's family, can actually deter their caregivers to actually understand what's mentally going on with them, and not sort of use the praying away sort of statement. So there's also a lot of psychoeducation. So to answer your question, yes, I think that that's an important element of the work.
Yeah, no, I think that's great. And I think the fact that you're saying the system where you work and the environment you work, that is part of your intake paperwork or whatever like system that it is that you're using, that's a part of the system that you have. I think that's something, it's important. In psychiatry, we have a cultural formulation interview that can be used to specifically get at the cultural elements, faith being one of them, that are important to a person. But really, I don't, at least in my training so far, I do not see it as common. And I'm recognizing now the deficit that is of, in psychiatry, where we're dealing with the holistic person, we're dealing with the biological, the social, the psychological components that impact mental health. From a social standpoint, I think there's a lot of room for improvement in how we tackle the spiritual side of things.
Yeah, I think that that's just a very important thing. And so is that, even though that's not how you said, it's not sometimes incorporated, is that something that you can still do if you think it's appropriate to assess the spirituality?
For sure. And I think so. Sometimes it's not all the time. So that's actually the way on Twitter I asked it. I asked the question of, do you never, sometimes, often, or always ask about spirituality when you're encountering patients? And I would say I probably fall into the sometimes category, where sometimes, like, let's say a patient brings up the idea that they're spiritual. So I distinctly remember there was one lady I worked with, and this actually wasn't in psychiatry, but she was talking so much about her church family and the people who were most important to her. So I quickly recognized that her spirituality was so important to her. And she asked me actually to pray with her. And that to me was beautiful. It was the first time I'd ever prayed with a patient. I love prayer. I think prayer is like one of the most amazing things. It is our direct way to communicate with God. And to be able to do that with a patient while providing her medical care, to me, I was like, I am allowing the spiritual component and her spiritual health to bolster her, to provide her hope through this new diagnosis that she had had. And that's one of the things, like when we're thinking about why is it important to know about a patient's spirituality, when we're thinking about hope, I think that's one of the biggest things. A lot of people who are spiritual, their hope is coming from that faith belief. So whether it's hope for future recovery, hope for just being able to make it through the right now, the community that it provides, taking away from loneliness, which can lead to depression or anxiety, the spiritual component can be so helpful. So for me, I think I'm at a point where one of the things I want to work on as I continue through my training is understanding how can we make those conversations about spirituality more common within mental health providers, as we're kind of just thinking about all of the parts of our patient that needs help.
Yeah. Yeah, I think you touched on a lot of important points, and that it's important to support if we're having these conversations about cultural competency, it's important to also support the spiritual side. I think that in the mental health field, there are some practitioners who are not comfortable with that, or who that's just a territory that they won't touch. But you have to, like, in my training, there's like, and maybe this is a statement you've heard before about like meeting the client where they are. And so you have to meet them where they are. And if they want, if spirituality is important, and if that's going to get them through this stage, then I don't see why not support it or encourage it. Like you said, I really love what you said about the baseline, sort of knowing what's normal for them, as opposed to that's just a little bit extreme. Like, for instance, if patients say I've heard from God, or I hear from God, asking more about what that means, not completely being spooked or this person is having hyper religiosity, but like
assuming that it's like auditory hallucinations or something.
Right, exactly. Not assuming that, because that could be very well what they believe. And, this idea of like holding on to a higher power, whether you call it God, whether you call it, what that patient identifies. I think it's important because as human beings, we are limited, and we don't want to be like, as, for example, as therapists, like, I think that we care deeply about our patients, but at the same time, we don't want to be the only outlet that they have. Yeah. Like, we want to, if spirituality is something that helps them, then that's really going to help them when you are not around, when the therapist is not around, when the doctor's not around, and it just, it's very limiting if we just focus on, if we just kind of like discourage that. Like in 12 steps programs, like they incorporate the higher power sort of element to help them recover from addictions, right? And so it's just a whole concept that you can't do it basically on your own. And then on the flip side, not also relying just on like, I'm just going to focus on God and I'm just going to let God fix all my issues, but also seeking help, which could be very well resources that God has placed for you.
Yeah. And I think one of the things you said before that stood out to me was the idea that people who are providers of mental health services sometimes feel uncomfortable with tackling ideas of spirituality. I don't know the numbers off the top of my head, but I have read where in medicine, psychiatrists tend to lean more towards being a-religious, meaning like they're not, psychiatrists tend to be less religious than other physicians. And it's so interesting to me where in a field where our patients are religious, that because of the biases of people, and not to say that the biases are bad, it's just the experience that they have of coming in from a perspective that is a-religious, not always remembering that for their patients, the religious aspect and the spiritual aspect might be important. And like one of the ways that I see that, and I really am having this time to reflect on how there are things that I think can be done differently in the way that we provide care. It's like in hospitals, so a lot of my work so far has been on the inpatient side, so working within hospitals for psychiatric care. And we have access to chaplains. So these are people who are providing spiritual guidance, spiritual counsel, and comfort to patients in the whole hospital, not just for psychiatry. And I cannot really think of that many times where, honestly, I cannot say I have ever offered it to a patient, like maybe once or twice. And I've seen like quite a few patients at this point. And for me, I'm like literally in this moment reflecting on the fact that, wow, as a person of faith, I haven't even offered this service to my patients. So how can I even expect that someone who is not of faith would think of that if it's not formally embedded in our training process or in our evaluation of patients? Because I think the things that are more commonly thought about are like physical therapy, occupational therapy, recreation therapy, like those types of treatments on the inpatient units. But maybe we should have the chaplains and interdisciplinary treatment team rounds and having them involved. I don't know. I think I'm literally like thinking of this right here on the spot. Like, I think that's something that we should consider because spirituality is really important to so many people and important to mental health recovery.
Yeah, I think that would be a really great idea to incorporate them because they are leaders that they might trust. And I know that there's church service at inpatient facilities, there's Bibles, offering those resources that already exist, like you said, in the hospital facilities. And so I really loved our conversation, Atasha. So just to Atasha. So just to end, what is a message that you would like What is a message that you would like people who rely on their mental health but don't seek it? I'm sorry. I'm going to start over.
Nice.
What is a message that you would like for people who rely on their faith but don't seek mental health services because they think that their faith is enough? And then what is a message that you would like for practitioners to have who, whether they're a-religious or not, are not asking questions about spirituality when they meet with their patients?
Yeah, I think so. Actually, so my my sweater, Jesus plus therapy. I think that really is the message I have for people. So patients, folks who are dealing with the conflict of spiritual health and mental health, recognizing that we can have both. So you could be Christian, you could be not, whatever it is your faith background is, that your faith and your mental health do not have to be in conflict with each other. I think that is the biggest message I want to be able to share, that the two can and should coexist. It's recognizing, though, when your spiritual well-being or recognizing where the distress that you're having, so the mental or psychological distress, is a mental health issue versus a spiritual health issue. So that is for me the biggest thing, that they're two separate entities that are very much related, but do not have to conflict with each other. And we have to find more ways to talk about how the two actually work together. So then the other part of your question is for providers. I think it's simple. I think right now, the biggest thing I want to get across is the idea that we have to be more cognizant of our patients' spiritual needs. And not that we as mental health providers will be the one to address their spiritual needs. Like, and I think that's a big thing. It's not that we're going to now start preaching or like being that spiritual support, but we need to make sure that we know what their spiritual needs are so that we can direct them to the right resources to get the help that they need. So whether that's like in a hospital setting, chaplains, Bibles, as you were saying, Katie, or when you're outpatient, like reminding people to connecting with their communities, that reminding them that to support their mental health, their spiritual health, and their involvement in those spiritual communities are things that we can encourage if that's something that they find beneficial. And that it's not taboo. It's okay to talk about it. Just like we talk about suicidality, we talk about homicidality, someone's spirituality shouldn't be something that we're afraid to talk about in the inpatient units or in our outpatient offices.
I think that you've just said it very beautifully. We shouldn't be afraid to talk about spirituality. Like we shouldn't be afraid to talk about race and culture. Spirituality is another aspect which can be embedded with culture. And so I just want to thank you for being here, Atasha. I really enjoyed our conversation.
Yeah, thank you. Thanks for the chance to kind of have this chat. And I really hope that folks feel blessed, and should feel free to just ask us any questions that they have, comments below. You can do that because yeah, this is a great conversation to have.
Where can they find you, Atasha, if they have questions for you or?
Oh yeah, so that's a great point. Literally everywhere. I have a website. It's www.atashajordan.com. So that's where you can find kind of my blog. You can reach me on social media. It's probably one of the best ways to reach me. On Instagram, on Twitter, I am just at Atasha Jordan. You can find me there. And then on YouTube as well, you can find me, just Dr. Atasha Jordan is the name of my page. You can search that because I don't know actually what the channel is called, but that Dr. Atasha Jordan is what you can find me on YouTube. So yeah, I think this is great and hope to be able to be in contact with some of you guys soon.
Yeah, I hope so. I hope that you reach out to Atasha. Like, she is such a great resource, and like she said, she's available on socials, and I'm really glad that we're having this conversation, and I really hope that others will also continue to have these conversations. All right, thank you, Atasha, for being here.
Yeah, thank you.
Thank you guys for watching this series. I learned a lot. I really enjoyed this series, and I hope you did too. Stay tuned for more videos, and please subscribe. Thank you.